Okay, we're going to reconvene. All right, I would love to hear from each group. We'll talk about, I guess, kind of each question at a time and try and capture some of this and see if there's themes that are similar. So what are the thoughts on what an optimal feedback environment looks like? Okay, great. So incorporating direct observation into the workplace so that you're able to provide feedback having directly observed. Okay, good. What else?
Having a private space, especially if there's something constructive or something.
Yeah, having a private space to deliver, receive feedback. Good.
I think being able to tailor it to the individual, because every resident is different, and their ability to understand what they're being criticized.
Great. So tailor to an individual. I'm going to.
What do you think would let you tailor things more effectively? That might be system level or environmental.
System level, I don't know, but with each passing year, you get to know the residents, and you can talk, and they're fine because they know that you have their best interests. It's a relationship that I think we have to develop with our residents.
So that longitudinal relationship building opportunities.
Even, and we talked about even on the show, having an attending resident pair instead of the resident kind of attending shopping, for their vacations, gives you that longitude just in that one show, so you can observe multiple patients and have a trend instead of just a data point.
Great. Continuity, the attending learner pair over the course of a shift. Yeah, great. And maybe over multiple shifts, if you can set that up. Good.
Talked about a system of accountability expectation. We talked about a culture of growth mindset. We talked about culture of
Vulnerability? Being okay to be vulnerable?
Yeah, on both ends, faculty being vulnerable to give feedback and not be afraid of maybe not being friends with the residents anymore. And the residents having the vulnerability to accept feedback without resorting to being a little too sensitive.
Great. Those are great.
Are there elements that you see that promote that? Or make that, that help promote that culture?
So I've had some I've talked with my residents about how to receive feedback, and one of the things that we talk about is there's for however many million years before you start residency, there's a right answer for everything, and so I try to retrain them about how to think about their training now. That when they're on with an attending, they're learning that attending's method, they're learning that attending's practice, and their ultimate goal is to take best of show and create their own practice. And that there's no point in arguing, and being defensive about your practice not matching their practice, because you're there to learn their practice, and that's it. And if you agree with it ultimately, great, incorporate it into your own. And if you ultimately disagree with it, fine, it's your practice, because you're now an adult learner, and that's nothing to do with A, B, C, D, or being right. And then when I have particular residents that are very defensive all the time with giving feedback, I will kind of sit them down in my office and we'll have coffee and we'll do this little exercise where I'll say, let's role play for a second. And I'm going to want you to criticize me, okay? And I'm going to set up a scenario and I have them criticize me and I am defensive. But wait, no, I did the heart score and I argue. I said, no, do it again. And then they criticize me in the same way and I go, okay, cool, got it. And then I just show them that the second one comes across as much more, sure and confident, and then the defensive thing doesn't come across that way. And then they kind of learn from that how to receive it.
That's neat, yeah. It reminds me of incorporating, you can even incorporate role play, simulation, opportunity to replay the events from the shift. That's a really neat idea. Great. Move to the question of current culture. So it's obviously going to be different at each institution. I'm curious if there were certain things that came up repeatedly at different institutions that you found were commonalities among different places, that were, maybe not in the optimal state right now, or common themes that came up, whatever they may be.
Faculty non-compliance.
Yeah, faculty noncompliance. We feel that.
Delayed and written only.
So, say that again.
Delayed, so
Delayed.
when you actually observe them.
Yep.
And only getting it in the written
Okay.
form, just for documentation.
Only getting written feedback, right, and no verbal shift feedback, that sort of thing. Okay, great.
And maybe add to that, the written feedback is very generic and very flowery at times.
Yeah.
Okay.
99% positive.
Poor quality of the actual written feedback. Yeah.
So there's one study from the internal medicine literature that described this as non-specific utterances.
Or the like long diatribe about how terrible the resident is, and they never talk to the resident.
They don't provide that feedback to the resident. Yeah, yeah. Good. And then barriers. So what barriers are there in the way of optimal feedback?
We talked about some of the things like that are optimal, like not having physical space, not having time, not having the ability to be able to give the effective feedback that you want to give that's relevant to your resume.
Yeah, that's probably true for a lot of these. The lack of right, the optimal. What's in the way of the optimal? Yeah. Other things?
Conflict is hard. We don't like conflict as humans. So, like, to initiate a difficult conversation is just, it's a hard barrier to overcome. Nobody.
Yeah, conflict. Yeah, being avoidant of conflict. Sure.
I forget, like, it's not a difficult conversation, I forget the name of it. But it's almost like
I
you
was
book
starting
club
on
and you
land,
start.
so share abundant sustenance, I feel like we're all like.
Yes, crucial conversations.
Yeah, these are great.
Interesting that feedback is construed as conflict. And I think that's a really fascinating observation that was made. And how do we move from this being a conflict and a difficult conversation to something that is a positive?
Right. Yeah, I think if you had an ideal feedback environment, you may not approach feedback as a conflict, and you may not see it that way or perceive it that way in an ideal setting, perhaps. Good. Okay. Well, thank you for discussing those points. I think that that really plays into this thought about what does an ideal sort of culture of feedback look like, and how might we get there. And we're going to return to that in a minute. The point that was brought up about quality of feedback, of quality of written feedback being poor, that is an area that is relatively better understood in the literature, just from the standpoint of we have a lot of papers that define what should good feedback look like. And from that, there have been some tools developed to say, can we rate the quality of feedback and provide a rating of that? And so I just want to go over a couple of examples of that. Yeah, this is very small for me, sorry. Bigger screen. So this is one of the first tools that came out that is often referenced related to this. This was a 2008 paper, so one of the original ones. This is called the Completed Clinical Evaluation Report Rating. And what these authors did is they came up with this rating system here with these 9 questions on a 5-point scale to say on an evaluation, on an end of rotation evaluation that's filled out for somebody, how good is that evaluation? And they look at these items. They look at the numeric ratings. So they asked, do the numeric ratings show sufficient variability to allow identification of relative strengths of the person? Are the comments balanced? Do the trainee's response to feedback and or remediation during the rotation is described in the comments? The comments justify the ratings provided. There's clear examples of strengths, clear examples of weaknesses. There are concrete recommendations for attaining a higher level of performance. The comments are provided in a supportive manner as one of the items, and that provides enough detail for a reviewer to clearly understand the trainee's performance on the rotation. This is a fairly detailed and a 1 to 5 rating for each of these. You could imagine how there might be fairly high variability depending on who's reading this, especially on a 5-point scale. And there's also sort of a presupposition of what feedback should look like, that it must include strengths, it must include weaknesses, it must include these other elements of recommending how to attain a higher level. And maybe good feedback should do that, but one of the critiques of this scale is that it's a little too nuanced and complex, and there may be a lot of variability in how people respond to that. So a few scales since then have emerged and compared themselves to this prior scale, which was the prior sort of gold standard, or actually only what was only available previously. One of these, some people may be familiar with, this is a Teresa Chan project, the QUAL, the Quality of Assessment of Learning tool. So this is an attempt to sort of simplify this down and look at, again, written feedback and rate that. And so they ask 3 things. 1, evidence. Does the rater provide sufficient evidence about resident performance? That's rated on a 3-point scale. So do they don't comment on it at all, or no, but comment present, 2, somewhat, or 3, yes, full description of resident performance. Then number 2 is suggestions. So do they provide a suggestion for improvement, yes or no? And connection. Is the rater's suggestion linked to the behavior described, yes or no? So what was kind of neat about this tool is that in their validation studies, they applied this scale to written feedback, and they also applied the prior one, the CCER. And they did these like G coefficients and various statistical analyses basically to show that there's a high degree of correlation between using this tool and the prior tool that was well known. And this is a much more simplified tool, which is now actually being used in like natural language processing and trying to get machine learning to apply this scale to written feedback to see if that matches human ratings, which is an entirely different discussion, but kind of a future direction. So the QUAL score emphasizes the description of the resident performance and requires that feedback includes a suggestion for improvement, otherwise they're missing a point. And so some of the critiques are that, maybe not all feedback will include a suggestion for improvement, or maybe we think it should, and then it includes assumptions about how the feedback will be structured, similar to the prior. There's a quality improvement instrument. This is actually 2017. This one is looking at feedback and looking at the strengths and areas for improvement in particular, and rating how well they do that. And so you get points for how much text you use to describe a strength and how much text you use to describe weaknesses. And so it's another scale that's been developed in the past few years that is sometimes used and measured against these other scales. Again, there's an expectation that feedback will include at least one strength and at least one weakness, which is, depending on feedback forms or the way people do it, not always the case. And so, again, sort of having assumptions about the structure of how feedback should look when applying this score. And then lastly, this is a very recent tool from 2022. This just came out, Evaluation of Feedback Captured tool. That is, the goal with this group's development of this tool was to have practical value to training programs for continuous quality improvement. They separate things out by basically saying if there's no written feedback at all, that's just a 0. But then they ask these questions. So does the feedback cover these points? What did the learner do? When, who, where? How did the learner do? What was done well or needs improvement? And how was it done well, or how can it be improved? And so it captures a lot of similar elements of the prior ones, but it really builds on a learner's level and looks at sort of, as they continue to progress, you're asking questions, not just yes, no, but you're asking how did they do this? What did they do that they did well? And so are we measuring feedback to say, are we getting sort of more context about the learner and their level within that written feedback summary, rather than just yes, no, they included it or not, or yes, there's a strength, no, there was not a strength. So some really cool recent developments of these tools. When we step back and think about it, so these tools are great. They're emerging. They're recent literature. This is where a lot of focus is being put on feedback right now. But again, this only targets in on quality of written feedback that's provided. And so this returns us to the question of, we know that feedback is more than just the quality of the feedback provided, and we are defining this greater area beyond that as sort of the feedback environment, the feedback culture. So I want to revisit this diagram that nobody can see and challenge the group to think of, having had this discussion about what goes into feedback culture, knowing that there's ongoing work looking at tools for quality of feedback, and knowing that feedback is more than just the quality of feedback, and we want to sort of capture that. can we create a tool, or can we think about how do we measure these aspects of culture at an institution? Could we develop a similar tool to one of these where we say we could go into an institution and ask, do they have a safe environment where you have a private room to talk about feedback? Do you have a situation where you feel like you're tailoring to your learner, tailoring feedback to your learner? Are those things that we would care about in a tool? So the challenge is to think what would go into a tool or a scale that we might generate to measure the feedback culture. It's a tough question. I think it'd be fun to sort of brainstorm and think about that. What are the things we care about that would play into that? I think we could probably, we work in a small group, but there's 5 minutes left, so we could just, if people have ideas, we could talk about it and sort of generate de novo. And I wish I could pull up the Google Drive doc, but I cannot.
So at the end, I can kind of capture notes from this session and themes, as well as with a list of references. If you want to stop by, and I'll share the Google, and I'll grab your email so we can ultimately share a little bit of a cleaned up version of this Google document.
So thoughts on measurables of environment we might care about. Okay, cool. So yeah, percentage. So yeah, looking at percentage of time feedback's given on shift, for example, in the verbal form, and then also in the written form you could measure.
And the verbal one would be, I would argue, the percentage, because that has to be reported from the person receiving it, and they very well recognize.
Right. We know that not all learners recognize they're receiving feedback when we think they're receiving feedback. Yeah, exactly. That's true. Yeah, written evaluations or feedback forms returned would be much easier to measure. That's true. Okay, and so percentage completion rates of that. Yeah.
Behaviors create a safe learning environment. So that just even the conversation of like, what did you do this weekend? Do you have any plans coming up? Like and how you give it like that social camaraderie factor.
Yeah. Yeah. How do you get at the social camaraderie aspect?
Like learning environment is one of those biggest things, and yet like how do you rate? Like what are the actual behaviors that create that psychological safety? Especially because a lot of them develop longitudinal.
Yeah, that's the same thing. The same question is how you make friends, how you just interact with other people, and that's such a moving target. I know people just because they're 6'5", residents are afraid to approach them. They just have that our department called bitch face. That it just is difficult. You can't really navigate that.
You could keep it simple, like with a subjective question, not instead of on a scale of 1 to 5, and say to the resident, do you expect to receive feedback at the end of your shifts? Yes or no, right? And then they have to choose, and like put a measure for what percent are choosing yes, what percent are choosing no. And there's exactly, do you expect to give feedback, or do you plan to give feedback as part of your shift? Yes
That's
or no.
good. Yeah, and then you could follow up with, do you receive it or whatever. But yeah, so looking at the expectation, right? So that may play into the culture if there's an expectation of receiving feedback versus if there's not, right? That's good. Yeah, you could see if there is a defined sort of private space for it. How about the vulnerability aspect?
I think transparency would be something to think about. Because transparency completes what Michelle said, which was a learning environment. So the more transparent you are, is it a surrogate for how comfortable the learning environment is?
That's good, yeah. Yeah, so transparency, and then thinking back to the resident, this where residents want to maintain credibility so that they feel safe asking for feedback. I think similarly for the person giving feedback, trying to find some way to target in on, do they feel safe giving feedback? Are there going to be repercussions for giving negative feedback to residents, especially as an early attending, where the evaluations you get might matter? Yeah.
Well, I think, I've been doing this, I'm just practicing medicine for many, many years, and I've made a lot of mistakes. And I noticed that when someone makes my mistake, I'm very quick, I think we should all be very quick to say, yeah, I've done that too. So maybe sort of jump in and admit that I've been equally stupid. So it's not you, it's just the way it is. You're going to make these mistakes. I've done them, you're doing them, and this is how we're going to go forward.
Yeah.
I would actually argue that it's the most memorable behavior. How many times do you, say, hey, I've been in those shoes? Like, because I was actually sitting here thinking of an attending Tom Germano from Rhode Island Hospital, and that is exactly what we would do almost universally with everything that's they would do that to us. And so I do come back to, I think there have to be behaviors that we can learn to identify that create the psychological safety. Otherwise, we're going to sit here and keep talking about create a safe space and create for a learning environment, but if there aren't specific behaviors associated with that, I don't know how we get to it.
Yeah, that's a great point. Yeah, thinking very carefully about how we look for those behaviors, right, that create safe space and openness to feeling like you can be vulnerable and safe in that. Those are great points. For,
And like the CMS basic assumption, it's like, if you hold that true of your residents and they hold that true of you, that everyone that is showing up to shift is trying to do their best and is intelligent and is going to work hard. Like, just holding that and, and having that as, what everybody's working under can be very helpful to creating that safe space.
that's great. Cool. Well, we are at the end of time. So this is obviously a discussion that our group is very interested in, and we'll continue to sort of pursue these questions moving forward. If you have interest in also participating in this and maybe generating new ideas and future abstracts and other things related to this, please put your email down on this Google Doc at the end. We'll share this with you, and then we can discuss on kind of future directions as they develop and evolve. Cool. Yeah, thanks everybody for participation. It's great.
Thank you.